Good afternoon and welcome to our webinar, How Have International Travel Restrictions Affected Freedom of Movement During the Pandemic? Europe is in parts a very densely populated continent, and some of its borders are also extremely densely populated. And we have lots of workers crossing the borders, either seeking employment there or commuting or sometimes working for weekends or assigned periods of time. We have tightly knit supply chains which need to be supported by transport, by uninterrupted transport. Tourism is very, very important for many countries, and we are all now watching the Euro 2020, and you see a lot of people crossing the borders all across Europe, actually. And of course, there are very close family ties across borders. So cross-border mobility, cross-border movement is really essential in Europe, but at the same time, of course, countries need to protect themselves from COVID-19 and now in particular from the variants of concerns, the Delta variant. So there are international travel restrictions like bans on air, land and sea travel, testing regimes, quarantine regimes, and monitoring systems that make sure that once you return to your country of origin, you will be very well monitored. So what have we seen actually over the last months, the last year? Uncoordinated and coordinated travel measures. What were the measures? What were the criteria? So we want to really understand today, how have travel policies affected the free movement of people across borders? And how have they changed in response to the vaccination rollout? And what are the international recommendations for implementing travel restrictions? And of course, this is now very much tailored to this very specific pandemic. But as many people say, the next pandemic is just around the corner and we need to get this right from the beginning. Today, we have lined up a great panel of speakers, and I would like to introduce to you Tanja Schmidt from WHO Regional Office for Europe. She is monitoring and evaluation officer in the Health and Emergency Program. And I think she's the best person suited to talk about this because she has just published evidence on international travel measures in Europe. As spotlight speakers, we have lined up for you Renato Laurencio Silva from the Directorate of Health in the Ministry of Health in Portugal. And of course, obviously at the moment, Portugal is badly stricken with the new variant and there are a lot of travel restrictions, and therefore we are very grateful that he has joined us. We have Rolf Appels from the National Institute for Public Health and Environment and the Ministry of Health and Welfare and Sport. And amongst the many things he's doing, he's actually also policy advisor in the WHO Collaborating Center on Infectious Disease, Preparedness and International Health regulations. And we have Juliane Knopp from the Federal Ministry of Germany. And later on, for the panel discussion, we will also be joined by Mariana Ferreira from the Public Health Emergency Operations Center, Ministry of Health, Portugal. So that is the moment that I hand over to my colleague, Erika, to start the audience poll. Erika, please, the floor is all yours.
Hello, everyone. Thank you very much for coming. Yes, just as a little bit of interaction early on, and to see where we all are, we'd just like to do a quick poll with you. Two quick questions. Firstly, just to see where we are at the moment, are you hoping to travel internationally in the next 2 months? And that's just a yes/no question. And then secondly, what international travel restrictions are currently in place in your country? And you can have multiple choices here. So are there entry bans from high prevalence countries, entry bans from countries where variants of concern predominate? Are there quarantine measures, testing on entry, eased entry for fully vaccinated travellers, or none of the above? Okay, so let us know your thoughts on that, and I'll give you the results of the poll after Tanya's presentation. Thank you.
So thank you so much, Erika, and I'm already quite curious to hear about the results. And now, without much ado, Tanja, please take the floor.
Thank you very much for the introduction, and it's a real pleasure being here in this webinar and to present a little bit of the work that we've been doing here. I'm based at the WHO Regional Office for Europe, and as part of the COVID-19 Incident Management Support Team have been maintaining a database on public health and social measures in response to COVID-19. And I will be presenting some of the data specifically in relation to international travel measures, and then at the end say a little bit about available WHO guidance documents as well as operational tools. Just to start and to put international travel measures into context, it's very important to consider that international travel measures are only one tool or one part of a comprehensive package of public health and social measures that countries have been implementing to reduce transmission and slow the spread of COVID-19. So WHO has classified broad 7 categories, ranging from individual measures, surveillance and response measures, social and physical distancing measures, such as gathering restrictions, school and workplace measures, international travel measures, and then of course vaccination, which is a big topic at the moment, and all in order to flatten the curve with this goal in mind. The Swiss cheese example nicely illustrates how a comprehensive approach is necessary, as no single intervention is perfect at preventing the spread. So it is really a combination of public health and social measures. There are, of course, challenges that come into play when you talk about decision making on PHSMs. It's about the right timing, how to communicate it to the public. Compliance and adherence to measures is an issue. And of course, the balancing act of understanding the mental health and physical health, social and economic consequences of the measures. So this is this map illustrates public health and social measures implemented in countries in the WHO European region over time. So it's a moving map. And this is, in short, based on our PHSM severity score coding, which is comprised of 6 key measures that are highlighted here on the right side. And then the darker the color, the more severe the restrictions in a country at a particular point in time. And I think this map really nicely illustrates the changing approaches countries have taken over time, with easing of restrictions, mostly over the summer period, especially as we're coming into the summer period 2021. We have currently 37 countries that have eased restrictions over the past 2 weeks. On the other hand, just a few countries that are re-implementing restrictions due to localized outbreaks, 5 countries as of this week. And we still have Turkmenistan, the Russian Federation, and Turkey as the countries with the highest severity score in terms of implementing public health and social measures. Now, zooming on international travel measures, we've all been affected by them, either privately or doing our professional work. As Matthias already highlighted, this is an overview of common measures that have been implemented by countries, ranging from entry bans, quarantine restrictions, either at home or at alternative accommodation. The COVID-19 testing has really increased in the past months. Several countries requiring passengers, travelers to fill out health declaration forms or registration forms, either in paper format or electronically. Proof of vaccination has really been a measure implemented increasingly, especially at the EU level. And then, of course, there is the more traditional risk mitigation measures, such as risk communication for travelers. So it is really quite a mixed bag of measures, and the combination used is very much differing from country to country. Not to go into too much detail, but I just wanted to highlight that, of course, under the international health regulations, a state party implementing additional health measures which interfere with international traffic are required to provide the public health rationale to WHO, who then in turn shares this information with other states parties. So we just wanted to show the most common public health rationales stated by member states for these travel measures. And not surprisingly, of course, it is mostly stated to prevent the spread of COVID-19, But there's also other rationales that have been used, such as to ensure public safety, prevent public anxiety, as a result of changing virus characteristics, including the variants of concern, but also as a result of a limited capacity of the countries to cope with increasing cases. So what have countries been doing? So this is really our overview slide. You have all countries listed here that are part of the WHO European region, mapped over time. And we again displaying here the PHSM severity index for international travel, with the scale listed here above. So the darker the color, the more stricter the entry requirements, combining entry bans, quarantine requirements, as well as testing requirements. And I think this mosaic here really shows the different approaches of countries, quite uniform. At the beginning of the pandemic, as you might remember, a lot of closures, countries really closed down for a period of time, but then opened up over the summer period. And now we really see a more nuanced picture, with most countries having some type of travel restrictions, with some countries completely lifting, such as Albania, and other countries such as Turkmenistan and Israel having very strict measures still in place, also only allowing entry for exceptional circumstances. And to go into detail a bit on quarantine and testing requirement, so based on our database, what we see is when it comes to quarantine requirements, it is usually a period of 10 to 14 days that have been implemented in countries. We only have Turkmenistan that are currently implementing a 21-day quarantine. When it comes to testing, as mentioned, this measure really has increased since the end of last year, with the majority of countries requiring tests either before arrival, on arrival, or with a follow-up test, often to shorten quarantine requirements. Just very quickly on the use of proof of vaccination for international travel. It's mentioned it's increasingly being used, particularly to lift quarantine or testing requirements. Again, here the approach differs between countries. They either have one or the other, quarantine or testing requirements, or a combination of those. And increasingly, especially at the EU level, member states that have connected to the so-called EU digital COVID-19 certificate, with 19 EU member states that have joined since June 2021. Lastly, and Matthias mentioned it in response to variants of concern, we do see an increase appliance of international travel measures of countries, from countries where VOCs emerged and have been reported. Currently, we have 33 member states that have implemented additional restrictions to variants of concern. And more recently, with the Delta variant of concern, there are some travel measures implemented for countries, for travelers coming from the UK, the Russian Federation, and Portugal when it comes to the European region. And you will hear a little bit more about it from the spotlight speakers. Just to close, I just wanted to mention WHO guidance that is available. Guidance is continuously updated. We have our key considerations document for implementing a risk-based approach to international travel in the context of COVID-19, which is currently being updated to account for the dimension of variants of concern as well as vaccination. But it follows the same structure as earlier, to really ask countries to conduct regular risk assessments based on a set of criteria, including the epidemiological situation, but also the public health capacity of countries, based on the results to apply risk mitigation measures and, of course, communicate to the public and travelers. So this is available, and I can put the link into the chat. When it comes to other products, so the data that I presented here is publicly available on our dashboards of the Euro COVID-19 dashboard, and also on a weekly basis shared through the joint ECDC WHO COVID-19 surveillance bulletin. And of course, with colleagues from the observatory, we have been publishing a series of cross-country analysis, which are published on the Health System Response Monitor website. So this is also all available in case you would like to have more information. But I'll stop here, handing over to you, Matthias. I hope I kept on time. Thank you very much for the opportunity to present. I'm looking forward to the discussions. Over to you.
Thank you so much, Tanya. That was quite perfect. A very good overview, actually, on all the different measures which are implemented by member states, but also fascinating to see the periodicity, how countries are implementing it and lifting it. And even though they stick to similar patterns, they do it at different times with different severity. And that also, I think, calls for the coordination. One of your last slide was showing recommendations, on handle all of this. And I think in the panel discussion, we will dig a little bit deeper into the coordination issue, because that is confusing many people, and all those who are at the moment making plans for their summer vacation, are confronted with very, very difficult choices. Thank you so much, Tanya. And now, Erika, can I ask you to present us the results of the poll?
Absolutely. So, yes, 3/4 of you are hoping to travel internationally in the next 2 months. Hopefully that's going to be as smooth as possible. And I was less surprised to see that with the travel restrictions that are currently in place in your country, no one said none of the above. So it seems like all the countries that are represented in the audience are doing something, and most commonly it's quarantine measures. So, but also there's quite a lot of people doing eased entry for fully vaccinated travellers, testing on entry, and a smaller number are doing entry bans from either high prevalence countries or countries where variants of concern predominate. So thank you very much for that, everybody. Back to you,
Thank
Matthias.
you, Erika. I think the poll results show that we are all aware of those measures in countries, and that they really affect our lives, that we really need to plan with them and to understand them and anticipate them. Thank you so much. And that's the moment where I would like to invite our first spotlight speaker, filling us in a little bit on the situation in Portugal. So Renato, the floor is all yours.
Good afternoon to all. It's always a pleasure to participate in webinars like this one and share the experience we have on applying travel restriction measures. As you said, I'm Renato from the Portuguese Directorate General of Health, and I've been working in the recent months on the implementation of the EU COVID digital certificate in Portugal and the related travel measures. As you say too, my colleague Mariana Ferreira is also here with us, and she works on issues related to the international health regulation, and will be available for the Q&A period too. So I will try to be very concise and put into context the measures that we applied in the recent months, maybe the last 2 months, by the Portuguese authorities and the government. And these measures trying to balance the control of the pandemic and the movement of the citizens, especially the tourism. So the framework that serves as the basis for the technical analysis and guidance, and after for the political decision, has these 5 assumptions. First, the CDC guidance and the CDC and the European Aviation Authority guidelines for regarding the travel measures. Second, the vaccination rollout at national level. And I can say that we already reached half of the population that have at least 1 doses of administered of 1 vaccine. And we have 30% of the population fully vaccinated. Also, the framework that we use as take into consideration the 2 Council recommendations regarding the travel restrictions in the European Union, and finally the regulation of the European Union digital COVID certificate. So, as a general principle, in place in the last 2 months, all passengers that enter in Portugal must carry on a certificate, a proof of a negative nucleic acid amplification test result, a PCR, and that test must have been carried out not more than 72 hours prior to entry. Recently, and alternatively, we also accept the rapid antigen tests that are listed on the common agreed list made by the Health Security Committee, and these tests must have been carried out not more than 48 hours prior to entry. We have also two considerations that passengers who are not in possession of such a certificate are required to undergo a test on arrival at the airport or at maritime cross border. And children under the age of 12 years, they didn't have to do the test to enter the country in line with the Council recommendations. Also, we have a general principle that all air at the moment are authorized from all EU countries, Schengen associated countries, and the UK, and in line with the Council recommendations from and to specific countries upon confirmation of reciprocity, like the USA, Israel, and other countries. Other countries outside of this list, only just essential travel are allowed to and from Portugal. We have put other restrictions from persons entering Portugal following a stay in an area which epidemiological situation is not in line with the Council recommendations. And if they have been in the last 14 days in an area, our focus at the moment is area where emerge or the circulation of variants of concern is predominant. These persons must self-isolate for 14 days upon arrival. On this list, the countries that at the moment that are on this list are Brazil, South Africa, India, Nepal, and the United Kingdom, with the exception of all passengers holding a vaccination certificate. Finally, this week, Portugal started to accept the EU digital COVID certificate, and the holders of a vaccination or a recovery certificates are not subjected to additional restrictions like testing or self-isolation quarantine. For that, the rules established for each certificate, for the vaccination certificate, the vaccine used must be one of the dose approved by the European medicine agencies, and a period of last 14 days must have elapsed since receiving the last vaccine dose. So fully vaccinated people after 14 days. For the recovery certificate test, at least 11 days prior, but not more than 180 days following a positive test result. What are the main challenges that we consider that can reduce the effectiveness of these measures and can have an impact, for instance, in the control of the potential introduction of variant of concern in Portugal? First one, Portugal does not have direct flights for some countries that are on the list, like Nepal. In many cases, it can be difficult to access where passengers have been in the last 14 days, especially if they have stops in other countries. The second, Portugal only has one land border with Spain, and at the moment there is a bilateral policy of minimal cross-border control, which makes difficult to detect people who have been in areas with a high of box. Third, paper certificate tests and falsifications. I think this is a problem for all member states, and one of the reasons for the introduction of the digital certificates. Four, the refusal to take a test on arrival. This is applicable to Portuguese citizens or legal residents in Portugal, and these passengers, the entry is not refused. And last, the compliance of self-isolation and quarantine. Depending on the territorial area where the passengers will comply with the required self-isolation, there may be few human resources to monitor this obligation. So it's all for me, and we will be available for the Q&A period.
Renato, thank you so much for zooming us in on the current situation in Portugal. And I think it's clear to see there are plenty of international travel measures in place, and they are quite complex and quite severe. But also thank you so much for introducing us actually to the EU approach to coordinate this a little bit, because as you mentioned, in October 2020 and updated in January 2021, we had from the Council of Europe, we had a common set of criteria or a mapping which is done by the ECDC to see what's the infectious situation in countries, but also in framework how to react to avoid a lot of confusion and misinterpretation and a difficult situation. So thank you so much. And I would like to ask our next speaker from the Netherlands. Rolf, please come on board.
Thank you very much for the invitation, and it's very nice to be here this morning. Always a pleasure to do these kind of presentations. Yeah, I am from the Public Health Institute in the Netherlands, the RIVM, and I'm working on travel advices in the Netherlands. So let's go to the first slide. I will tell you a little bit in this presentation about the decision-making process, about our main measures and policies and restrictions, and I will share a field experience with you of the beginning of this month. But let's start with the risk and with our policy making process. Every week, the RIVM, the National Public Health Institute, does an analysis of risk analysis of the different countries in the world, according to different thresholds and indicators, which we have been advised on by our outbreak management team. And the decision basically on which thresholds and indicators to use is made together with the National Public Health Institute and the Ministry of Health. Based on these thresholds and indicators, we make an analysis. We send every week to the Ministry of Health, and the Ministry of Health then goes to the EC to discuss about the EU travel plans, and works together with the Ministry of Foreign Affairs to basically define the travel advices. And the Ministry of Foreign Affairs is responsible for the travel advice and to color code the countries and also to communicate the travel advices. Implementation, of course, is done by the different government bodies and different ministries. So let's go to the next slide. There's different restrictions that we have. Of course, we have the EU travel ban, which everybody knows, and then we have different levels of risk, which we determine is no increased risk, where passengers that come into the Netherlands don't have to adjust to any measures or restrictions. Then we have the increased risk with high incidence, and for instance also countries with the EU travel ban. And we use for high incidence, we use the EU threshold now of 200 per 100,000 per 2 weeks. And if you come from a country with a high incidence, you have to do a NAT test before entry. And no quarantine anymore. That was dropped last month. So only a NAT test before entry. With a very high risk, and that could be because of VOCs very prevalent in the country, or a very high incidence, above 500 per 100,000 per 2 weeks. A NAT test is required, and also an antigen test just before in the last 24 hours before departure to the Netherlands, if it considers a VOC threat country, before entry, and compulsory quarantine, which lasts for 10 days or till a negative test after 5 days. The flight bans that we had on different countries, especially based on, especially for VOC countries, were stopped after the implementation of the compulsory quarantine. And now we go to the next slide, where I also want to share with you a field experience that we had in the beginning of this summer or in spring. We had in May this year, we had the situation that Ibiza, Mallorca, and Portugal had a low incidence. and were basically regarded as being on no increased risk level. So that means that there were no restrictions or no measures for people traveling from these places to the Netherlands. And what we saw in the first week of May was that we had cases from Ibiza. People that had been for a short spring break to Ibiza were already returning with COVID-19. Which basically, already said to us like, oh, let's guard the next weeks because we have our scholars going on holiday. It's a habit in the Netherlands that after your school exams, so high school exams, a lot of scholars go to Spain or to Portugal or to Greece in the past, but Greece was now still on a high level, so they mainly went to Spain or Portugal for a short break, mostly less than a week, 4, 5, 6 days. They're going there, and what we saw that we had more than 300 cases between the age of 15 and 19 returning with COVID after such a break, and more than 200 of those were probably infectious during their flight home, or they were pre-symptomatic, or they were symptomatic on their flight home. So these were 200 cases we had to do contact tracing of airplane contacts on. And most cases that returned from Mallorca returned with the Delta variant. That's what we know already. It could be that Portugal also had the Delta variant problem, for instance, but we don't know that yet because we are still examining that. And what we suspect is that these scholars basically have brought the infection with them to these countries and have then infected their friends and relatives and so on around them to return all together with COVID to COVID home. So the take-home message is low prevalence does not mean low risk for tourists. And what we are now doing in response of that is a big information campaign on people that go on holidays and make sure that they have accessible testing so that they can get tested when they return from the holidays. And we are going to distribute also self-tests, especially to young people, but also to other tourists that come home from the holidays this summer, so they can do it self-test at home if they cannot go to a test center. That was my presentation. Thank you.
Thank you so much.
I have some links here as well for the where you can find the travel advice, and some are also translated in English on these websites.
Thank you so much for filling us in on the governance of international travel measures in the Netherlands, the measures you have at the moment introduced, but also sharing a little bit of the experience you have and what you said, that low prevalence doesn't mean low risk for tourists is a little bit worrying, also bearing in mind that we have the Euro 2020 still ongoing and a lot of travel, and of course the travel season is just starting. Thanks a lot, and this is the moment where we turn to Germany, and I would like to ask you, Juliane, to give us your 5 minutes, please.
Share some experience we have made here in Germany regarding travel measures, and talking about travel that fits well to the hot temperatures here and the holiday season, which just started here in Berlin last week. But traveling doesn't always have a positive effect and is good during a pandemic like Corona, as we can see here on the graphic. Last summer, in mid-August, we have a peak of the cases with exposition abroad. So in mid-August, we had half of the cases with travel history. So what can we do to avoid this? We have set up a risk assessment process to classify countries with higher risk of infection as risk areas with respective testing and quarantine requirements. That means the federal government, in particular the Federal Ministry of Health, the Federal Foreign Office, and the Federal Ministry of Interior, together with our National Public Health Institute, the Robert Koch Institute. So we examine on a regular basis which countries or regions have to be classified as risk areas or declassified. We differentiate between 3 different types of risk areas. we have the basic risk areas where the 7 days incidence is above 50 per 100,000 inhabitants, plus qualitative criteria, for instance, the testing rate, positivity rate, vaccination rate, and so on. We also have high incidence areas where the 7 days incidence is above 200 per 100,000 inhabitants in the previous 7 days. And here we also look at qualitative criteria. Together with the Federal Foreign Office, they have their embassies in the countries, and that is always quite helpful. And our third type is the variant areas. This is an area where we assume there's a distribution of worrisome variants. And here I say worrisome, so it's not only variants of concern, but it can also be variants of interest. And as the new variants are quite a challenge right now regarding the travel season, I would like to briefly touch upon the criteria for our classification of variant areas. So we have 3 main criteria. The first one is virus characteristics. So we look at the characteristics of new variants that can be variants of concerns, as I said, or of interest. So those are characteristics like higher transmissibility, or where we see immune escape, also regarding vaccination or recovered persons, or the virulence. We also look at the distribution of the variants of interest or concerns in the countries, and also the domestic occurrence. So we also look if the variants here in Germany are not yet occurring or comparatively rarely. And what does it mean in practical terms when we have those 3 different risk areas? So we have the basic risk areas. That means you have to have a negative test within 48 hours of entry, but you can avoid or determine the quarantine earlier with a negative test, or if you are fully vaccinated or you're recovered. For high incidence area, we have a 10-day quarantine, but you can end this quarantine at day 5 if you have a negative test, or as I said, if you're recovered or fully vaccinated. But the difference to the basic risk areas is that you have to have a negative test when entering Germany. For the variant areas, this is stricter. We have a ban of transport for travelers, but with some exceptions. We have a 14-day quarantine, and you cannot determine the quarantine earlier, so you have to stick to the 14-day. And even though you're recovered or fully vaccinated, it's always 14-day. And you have to have a negative test before entering Germany. This was it. I tried to skip to the 5 minutes. Now I'm at 3 minutes. So if you have any questions, please feel free to ask questions. I have some couple more slides to show if you want. Thank you.
Thank you so much, Juliane, and thanks a lot for filling us in so efficiently on the situation in Germany. And to some extent, I think it mirrors what we've heard about the Netherlands and also Portugal. But one takeaway from your presentation is actually that we really need to fine-tune or calibrate actually our travel restriction with regards to the variants. And you've introduced quite hard measures for the new variant, the Delta variant, where you cannot escape actually quarantine if you come back to the country, because we are so worried and don't really know yet to what extent you can still transmit it. So thank you so much, and that is the moment where I would like to ask all the panelists and speakers to switch on their camera. And Erika, please let us know what's coming through the chat box. If there's not so much, actually, I have also a question for the panelists.
Okay, well, maybe I'll let you ask a question, but there are some questions have been coming through. Some people have been cheekily emailing them to me instead of putting them in the chat box. But yes, really interesting point that sort of draws on what Rolf was saying about the Netherlands, the big outbreak in the Netherlands. But I think it goes deeper than just the Netherlands. It's about cross-border cooperation in contact tracing. So how closely can you work across borders with public health authorities in Mallorca or other sort of tourist destinations when you get an outbreak domestically? How closely can you work with authorities in Spain or Portugal or other areas where people go on holiday? Another question would be, so how do different rules for different types of traveller work? So how would rules for tourists work, or as opposed to rules for commuters? Because obviously in some areas of Europe there's an awful lot of cross-border commuting between France and Switzerland, for example, everywhere in Luxembourg. So how do we cope with that relative to tourism or people returning home as a different category? And go on then, Matthias, I'll let you ask your question because I'm feeling generous.
Yeah, my question actually relates quite to your last question. We had in March 2020 a communication issued by the European Commission, and they were defining categories of critical workers that should be exempt from travel bans, actually, and dealt like residents in the country. And healthcare workers are, of course, amongst them. And we had this notorious example when Germany in February closed its borders to Czech Republic and the Tyrol region of Austria. And as a matter of fact, they respected this with regards to health workers. They let the health workers through that were commuting, but not the other workers, which were also considered critical workers, like lorry drivers, for example. And I would just wonder how other countries are dealing with this, because in the pandemic, it's very clear all hands need to be on deck, and health workers need to be able to get to their place of work.
Okay.
Shall we start with you, Tanya?
Sorry, just one quick question for Portugal about variants of concern in Portugal and what the situation is there, because obviously as a country which welcomes people from around Europe, it might be a particular concern. So yes, thank you. Sorry.
Tanya, please.
Yes, maybe I'll pick up on your question, Matthias, and leave the other ones for country presenters. I think indeed this conversation about essential versus non-essential travel is a really important one. And I mean, WHO also, similar to what you pointed out for the communication from the EU, is that international travel should really be prioritized for essential purposes as defined by national authorities, but should include, for example, humanitarian actions, emergency supply, travel of essential personnel, repatriation, etc. So similar in the beginning, especially of the pandemic, there were also some issues with getting deployments, even from our side, into countries, as well as essential goods. So yeah, a very important topic. And I think within the EU, this cross-border travel for work purposes is another dimension.
Excellent. Mariana.
Hi, thank you for your question, Erica, regarding the Delta variant situation in Portugal. Indeed, we are one of the countries, of the European countries, with a worst epidemiological situation regarding this variant of concern right now. And what we know regarding the latest available data is that the proportion of sequences corresponding to the Delta variant is about 70% right now in the Lisbon and Tagus Valley region that comprises Big Lisbon and the involvement area. Whereas it is just about 20% in the north region. So we have a big gradient across the country right now. We'll keep updating this data during the next few days, and including data for the other regions, as sequencing is now being taken continuously.
Thanks a lot. Renato.
We are trying to put some effort, some travel restrictions inside Portugal to stop the transmission to other regions. But it's expected that the Delta variant share of circulation will increase across all the country, namely the Algarve region and the Alentejo region. One of the main challenges that I referred in my presentation is the control of borders and the land borders. And we have a lot of seasonal workers from Asian countries working in agriculture. And maybe it could be one of the reasons. Another one for introduction of the Delta variant, and another one the exposition to the British travelers and British community that lives in Lisbon and Algarve. And it was and it is being a challenge to control the introduction of the Delta variant.
So you're just raising another issue, which is actually travel from third countries to EU country, which is regulated again slightly differently. Rolf, please.
Well, first of all, the Delta variant in the Netherlands is increasing a lot, and we think it will take over. Basically, will be the majority of the infections within a couple of weeks. But that on the side. On international cooperation, there was a question from Erica through Erica. We work with closely together with the national focal points, of course, through the national focal points and EWRS system, also communicating about for contact tracing, etc., etc. Also in the Netherlands, we have quite some exemptions from the crossing borders, from the measures and the restrictions. Lorry drivers and also people that just work across the border. We have a lot of people that live in the Netherlands and work in Germany, or work in Germany and live in the Netherlands, the other way around. And also with Belgium, we have the same thing. They are exempt basically from all the measures, so they don't have to test every day that they have to work to travel to work. Yeah, so that's the main important, I think, main important answers. I don't know if there are any other questions.
Thank you so much, Juliana.
Hi, so I can echo what Rolf was saying from the Netherlands. Also in Germany, we've seen an increase in the Delta variant, and the same here. We expect that Delta will be predominant in a few weeks. And regarding the commuters, you were mentioning Germany with Tyrol. We also had Moselle in France as an area of variant of concern, and also Czech Republic, as you were saying. And of course, it's sort of a hot potato. We like potatoes here in Germany, so we discuss it quite often. And yeah, there is no best way how you can deal with it. And we tried our best. So we thought that some of the exemptions for critical workforce, for health workforce, is valid. But as I said, there is no. I think there is no right way, and this is also discussed in the international fora. Thank you.
Erica, is there anything else coming through the pipeline?
Yes, one question which was quite technical, but I think it'd be a nice one to finish on, because it's looking to the future. So this is something to maybe think about in time for the next pandemic. But what are the alternatives? What are the alternatives to limiting travel when it comes to protecting public health in this sort of incident, in this sort of cases? So what are all the alternatives in the pipeline, things that we could do differently next time? So any ideas, basically?
So it's a bit about what we've learned so far, and we were mentioning the coordination efforts within the EU, but also, of course, the guidance from WHO. Would we do something slightly different next time, earlier, more focused? Tanya? Or
either from that perspective, or are there any technological solutions we could consider, or anything like that? So what are people thinking about for next time? Because hopefully, hopefully there won't be a next time, but realistically there probably will be, and this pandemic will end at some stage, and we need to prepare for the next one.
Maybe I'll start with a few words. Really interesting question, and I think this could be a whole hour of discussion. What have we learned? And of course, there's a lot of data coming out, or findings coming out, also from country interaction reviews of reviewing the responses. But when it comes to international travel, and I think the mentions were already mentioned by the other country spotlight speakers. The pandemic is changing and it's evolving. So things like the variants of concern that are emerging in some countries and might be coming to your own country, that really ignites a little bit the discussion on putting additional travel measures in place. And I think this will be an ongoing discussion to be had. What we've seen is, especially compared to the beginning of the pandemic, that as you've heard as well, that this risk-based approach is really being implemented on an increasing basis. And I think we can learn from the coordination efforts as well as from at the EU level with having a set of common criteria that countries can refer to, of course, tailoring it then to their own context. And I think there's also, of course, a different dimension, whether you're a country with high incidence or low incidence versus the country, the travelers coming in. So I think these are some of the main areas. And of course, we have the additional element of vaccination, which we didn't have at the beginning of the pandemic. But just really to iterate that it's a package of public health and social measures. It is not, international travel measures will not solve the issue, but it is a comprehensive approach also at the national level that should be taken.
Thank you so much, Tanya. I think I heard a couple of very important leads. Number one was coordination, because I think in the beginning there was very little coordination between countries. And number two, you said common criteria, which is also very good. But also, of course, we need to base the common criteria on a common evidence base, that we agree, what are the situations in the countries, and that they are reliably reported and in a timely manner reported. And you, with your database, you certainly contribute to this massively. And of course, the ECDC is currently supplying us with the maps, what the situation in Europe is. Mariana and Renato, if you could start all over again, how would you address it? Would you impose travel bans much earlier?
Yes, I think I'm going to reinforce what Tanja said, and we have to monitor more and better, and genetic sequencing more that we are doing now. Second, we have to act sooner. And third, a common approach at EU level. We have the Council recommendations, but the countries have different interests, and they don't follow strictly the recommendations, and it's difficult to act like a bloc in these conditions, and the challenge appear sooner or later.
So partially back to basics, we need to do the data better, more sequencing. I think the UK and Denmark are leading actually in Europe, but many countries are still lagging behind, and that is particularly difficult now when the incidence comes down. But the other thing you said was also very interesting, and it gives us a little bit a dose of realism, that there are still a lot of different interests. You can figure that countries with a large tourist industry, they need to open a little bit earlier, and they are hesitant to close. So there are conflicts, even if you are having frameworks and coordination. Rolf, can I ask you very quickly?
Yeah, I think, of course, timeliness is the first issue. I think we were too late with recognizing that this virus could be so dangerous, and it was already spreading in Europe, and we started to take it serious. Yeah, travel restrictions will only slow down, especially in countries like the Netherlands, where we are so dependent of trade, logistics, and so on. The best way basically is to become an island. I think like Iceland, New Zealand, and Australia. I mean, these countries are doing very well because they can basically stop the travel from outside. Yeah, I don't have many alternatives which could really stop the pandemic. But the main important thing is to make sure that your population is protected as soon as possible, so that your country can deal with in that way with import if that occurs.
Great Britain,
I live on an island,
Wales,
and
Scotland are an island, and it hasn't helped them much, actually.
Yeah, I was just about to say, I live on an island, and it didn't help us. Yeah.
Yes. Exactly.
Here in the UK.
Thank you so much to all the Spotlight speakers, and I would like now ask Tanya to wrap up the session with me, and I guess you have probably a couple of key messages or conclusion you would like to share with us, Tanya.
Thank Thank you, Matthias.
Oh, wait a minute. I forgot Juliana. Juliana, please. Sorry about this.
No worries at all. I just wanted to say that we have already learned quite a lot. I don't want to say that we are perfect, but when I look at all the repatriation processes we had last year and the paper-based passengers locator forms, which we handed out on planes, so we are learning and we are moving forward. But of course, there's a lot to learn, and my previous spotlight speakers said it all. So thank you.
But I guess also it strengthens a little bit your relation with other ministries, because you're working now across all ministries, and you were mentioning the foreign affairs ministries, which is now probably finds you more relevant than ever as a Ministry of Health. So the learning process might be also on other sides. So Tanya, please give us your final wisdom.
No, just, I mean, a lot has been said already, which I actually had noted down, but I think maybe two key takeaways. I think it's again, the topic of prioritization of travel for essential purposes. That should, I mean, is a really important point to be emphasized, especially when it comes to cross-border work and emergencies and humanitarian actions. And then, of course, the second message, and we've heard it from everyone, is to really do a timely and regular risk assessment, take a risk assessment approach to not just international travel measures, but also national measures on a set of criteria. Of course, it's evolving and will be changing, but I think there's a lot of great documents out there and approaches out there that can be adapted, and we hope to extend it to the whole of the WHO European region as well, to have this the common approach as much as possible. But thank you again for this webinar and for the opportunity to
Thank you so much, Tanya. I see there's a lot of learning, even though the learning came with a high price, and I hope that we capitalize on it the next time we are facing such a situation. Thank you so much to all the speakers. Thank you so much to the audience. And please tune in next week when we will have a webinar on small states in COVID-19. Bye-bye. Take care.